Great. So I want to welcome everybody to the public hearing on the emergency regulation governing the control and prevention of COVID-19 mandating vaccines for individuals working and dining at indoor dining locations. We're going to begin with a roll call of the members of the Board of Health who are here in attendance. So I'll call each name and please answer aye if you're here. Dr. Hamid Ismail. I think you may be muted, Dr. Ismail.
I apologize. Dr. Ismail, go ahead.
I'm here.
Thank you. Dr. Marla Gold.
Here.
Dr. Scott McNeil.
Here.
Dr. John Rich.
Here.
Dr. Ana Diaz-Rue. Dr. Jennifer Ibrahim.
Here.
And Dr. Tyra Bryant-Stevens. So before we hear from the public, I just want to note that the board will take the public comments that have been submitted already and those that we hear today into consideration, and we'll issue a report indicating what, if any, changes will be made to the regulation that has been adopted by the board at a future Board of Health meeting. So with that, I'm going to turn things over to Ben Hartung and to Joe in terms of any details on how we're going to let people comment. Could one of you fill in that information?
Sure. Thank you, Commissioner Bedegal. Good afternoon, everyone. My name is Ben Hartung, and I'm the Public Policy Advisor for the Division of Chronic Disease and Injury Prevention with the Department of Public Health, and I'll be facilitating the public comment process this evening. As the Commissioner said, we're accepting comment on the emergency regulation governing the control and prevention of COVID-19, mandating vaccines for individuals working and dining at indoor dining locations. And the way that we want to proceed is that if you could please leave in the chat your name if you would like to submit a comment, and then I will be able to unmute you and allow you to speak as we move through each person who likes to speak. And if the chat function is not working for you, you can also use the hand raise reaction, and I will note that you would like to speak. So I will give it a minute for people to submit that they would like to take the floor tonight, and then I will proceed to announce that person's name and unmute you, and you'll then be able to have the floor to give your comments. And we just want to let you know that we're going to stick to about a 5-minute time limit, just because we want to have enough time for everybody to speak, and there might be more people joining, so we want to be able to accommodate everyone. And so I see people are starting to drop their names in the chat, and I will just wait here a minute while people do that, and then I will start moving down the list.
And while we're waiting, Ben, I see a phone caller in the waiting room. I don't know if we have a way of letting that person in.
Thank you. I will let them in right now. And I will just repeat, hello, caller who just joined the meeting. Right now, we are taking names for who wants to speak, but since you're calling in by the phone, I will call out your cell phone number and unmute you when we get to your turn in line for comment. So thank you for joining the meeting, and please stay on the line if you'd like to give a comment. Okay, I see we have a couple people in the chat, so I will begin taking comments. The first person who has responded is Dan Auerbach. Mr. Auerbach, I will unmute your mic and let you speak.
Good afternoon, members of the board. Thank you for accepting my request for this hearing. I do appreciate it. The reason I appreciate it especially so is that the public has not had an opportunity to weigh in about these measures. These measures have been adopted since the beginning of this pandemic without the vote of City Council by fiat of this board and the Department of Health. So I do appreciate the opportunity to speak about these measures. These measures you've adopted are not lawful. They are contrary to your power under both the city charter and the city code. This board has not mandated vaccination as it might have the power to do under section 6210 of the Philadelphia Code. What it's done is require restaurants to verify the vaccination status of their customers and to require people to show papers to get into restaurants. That is not a power that exists under the city code. Your powers are limited to what City Council gave to you, and you've exceeded them without a vote of City Council. Only City Council can adopt this measure, and it has not done so. And the process you've used to do this is also unlawful. We spoke about that at the last meeting based on my comment. And Joe, who I respect very much, my former colleague, advised you that if you had a public health reason for this measure, you could suspend and ignore the provisions of 8407 that required a hearing before adoption of the regulation. And that's not the standard. You can all look at annotation 11 to section 8407 and see that you can suspend these requirements and adopt a measure prior to 30 days notice and a pre-adoption hearing only if there's an emergency, without which the measure will court disaster. There would be some disaster if you don't act now. And I think the text of this board's regulation says otherwise. The effective date of this regulation in full is not until January 18th of 2022. This measure was announced more than 30 days before that. There's no reason you couldn't have given 30 days notice. There's no disaster here. You're willing to wait a month. So what's the disaster that it both exists and you can wait 30 days to address it? I don't understand what that could possibly be. Another problem here is we're saying there's an emergency since March 11th of 2020 until present. It's an indefinite 22-month emergency. That's how tyrants operate. They declare indefinite emergencies. Caesar did that. That's how he came to power. That's what you're doing here. When is the end of the emergency? When does it stop? Is it forever, or do we just have to accept at some point there has to be a return to normalcy in terms of process and procedure? And I don't think the board can justify this delay. I also don't understand the substance of this requirement. We say you have to be vaccinated and show papers to get into a restaurant. But if you were vaccinated 10 months ago, that's okay. Even though we have medical studies that say the vaccine is not going to prevent transmission 10 months after the fact. It's going to be worthless. The same is true with so-called natural immunity, where if someone recovers from SARS-CoV-2, they have strong natural immunity going forward. Many hundreds of thousands of Philadelphians have recovered, are in that position. This board doesn't consider that. So they don't count. So really what this is about, it's about saying you have to comply with our dictates. You have to be vaccinated even if there's no real purpose, and a vaccination counts even if it's really not going to do anything for the public health. And you have to show papers to go about your daily life in America. We don't do that in America. We have liberty. You don't have to prove that you're among the clean or among the people who complied in order to go about your daily life. And I don't understand the public health benefit. I don't think this board has done a cost benefit analysis. I don't think there's some study you're relying on that says we're going to prevent this many number of COVID deaths or hospitalizations. You know, we just have seen this adoption of the same measure in Chicago and other cities, coincidentally, with a January 3rd adoption date. And I don't know what the study is. I don't know what the cost benefit is. I don't know how you've determined that this will do anything. I mean, look at the exceptions to this law. You can go in to a restaurant to pick up takeout food, even if you're not vaccinated. So somehow, if you're there for some permissible purpose that the board's okay with, well, you're not going to spread COVID, even if you're unvaccinated. I'm not sure how that works. I don't think it does work, and I don't think there's any evidence for it. And most remarkably, this board's regulation applies to private homes, not just when a business operates in a private home, but if I have a gathering of 25 or more people in my home, I have to check the papers of everyone who comes into my home and kick anyone out of my house without vaccination papers. I have no idea how this board thinks that it can intrude into our private lives in this manner. I don't see how it's constitutional. I don't see why I can be forced to do this board's bidding and check that paperwork. I don't see what the purpose of that is. And at the end of the day, I don't know how this measure is designed to serve the public health. It's simply not, and it violates the code. It violates the charter. It violates Pennsylvania's constitution. It violates common sense, and it violates basic decency. And what this regulation really does is it tries to build a segregated society where people who don't obey what this board does or what public health authorities demand is rendered unclean and not fit to go about their daily life, not fit to go about their business, and excluded from everything else. And there isn't a rationale for that. There isn't some huge benefit that we're going to obtain. We're going to save thousands of lives. There's almost no benefit, if any, of this measure. And we should not build a segregated society for this reason. It's wrong. And I would ask the board to get rid of this regulation in its entirety. Now, I understand the board's unlikely to do that. But what I would ask this board to do, if it says no, we're going to stick with it. Tell us what the rationale is. Tell us what evidence you relied on. Tell us what the basis for it was, because there are hundreds of thousands of Philadelphians who feel like I do. And our biggest complaint throughout this pandemic has been, no one will tell us what evidence you're relying on. What's the rationale? How are we doing this? When is this going to end? What's the goal of these measures? We've had our questions unanswered. Many of us, like me, have filed right to know law requests, FOIA requests to try to get this information, and we're stonewalled. So none of us know what you're thinking, what the rationale is. So if you do stick with this, please just tell us what the basis is. And then if people can present evidence to show you're wrong, that it doesn't make sense, please be open to the evidence once we know what you're thinking so that you can make a rational policy choice on these measures that have affected so many people's lives that I think are wrong. But if you disagree, please tell us what the rationale is. And with that, I would finish.
Thank you very much, Mr. Auerbach. I appreciate your comment. I will now move to the second person, who is Lynn Landis. Miss Landis, I hope I'm saying your name right, but I will unmute you in 1 second. Give me a moment. Miss Landis, the floor is yours.
Yes, thank you. My name's Lynn Landis. I'm founder of a group called healthalertphilly.org. And on that website, we have a lot of information, studies, and all that analysis, but these are general comments. And I want to also agree with the former speaker. I completely agree with with the points he's made. There is no emergency. There never was any emergency for COVID-19 that doesn't seriously affect 99.9% of the population. This is bullying. This is tyranny. This is bribing and blackmailing people to do what you want them to do. And that is to take a vaccine of which the ingredients people have no clue. So this is also not informed consent, which is in violation of the Geneva Conference. You cannot make people under the Geneva Conference take a medication that they don't know what's in there. And that is what's happening right now. So I want to make some general points. There is no pandemic exemption for the Bill of Rights. There is no pandemic exemption. So you are violating grossly the Bill of Rights. And as the previous speaker had said, there seems to be no end to this. You're setting a horrible precedent. Secondly, mass vaccination and mass medication is an invitation, an open door to mass contamination and mass poisoning. That's just common sense. Issuing an endless series of mandates on the public, schools, businesses based on the virus of the month has created an unnecessary chaotic environment where it is difficult, if not impossible, to function as a civil and sane society. Mandates are also an invitation to government abuse and interfere with the patient-doctor relationship. You've completely abrogated that. This is government control over our bodies. That's what this is. There is no more doctor-patient relationship. That is what you're eliminating with these dictates, specifically to COVID and its variants. Why follow CDC guidance when it has been proven that the NIH funded the gain-of-function Wuhan research, which caused the pandemic to begin with? That is akin to letting criminals, known criminals, run the Justice Department. For 99% of the population, there is no serious harm from COVID or any of its variants, particularly for the young, yet they are being mandated to take this vaccine and suffering serious injuries and death because of it. This is unconscionable. To date, there has been zero risk of death for Omicron and little risk of hospitalization. And it does appear that this pandemic, if you want to call it that, is winding down. So why now the mandates? It's very suspicious that this has to do with elections, not with health. So going back to, there is no informed consent when no one knows what the ingredients of these vaccines are, and particularly when manufacturers such as Pfizer has requested the FDA to keep its ingredients quiet or secret for 55 years. That is a giant red flag. Who would do such a thing? And there are no long-term studies of COVID either. They just came up with this vaccine. No long-term studies, and yet we're mandating it. The other thing is the serious side effects of these COVID vaccines are being reported to VAERS. Hospitals are filling up with the vaccinated, not the unvaccinated. It hasn't been reported that none of the vaccines that have been actually approved for use by the FDA. The one that was is not the one that's being used. So people are still getting the emergency use vaccines, and you're mandating that. I mean, it's a huge litigation, it's a wall, a tsunami of lawsuits. It's going to be, this city is going to be facing, not only because of illness and death due to these vaccines, but also because of loss of property, finances, all of that. Natural immunity is being completely ignored. If you're already naturally immune, getting a vaccine has its own serious side effects. You do not vaccinate somebody with the chickenpox vaccine who already had the chickenpox. That's very bad for them. And yet this is being completely ignored. The emphasis on cases, on PCR tests that have been calibrated to produce a flood of false positives. So the PCR tests, Dr. Fauci admitted anything over 36 is going to be producing tons of false positives. So where is it put? Oftentimes, if you can even find out where the PCR is being calibrated, at 40, that'll pick up the bacteria in your mouth. This is fraud. This is fraud. That's what this is. And I'm almost finished. The CDC has deliberately and grossly inflated cases on their guidance. Specifically, it says COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. It's everything in the kitchen sink is being termed COVID. That's how they got the 800,000 deaths. And then they reverse it for deaths due to the vaccine. This is criminal fraud. That's what they're engaged in. And they financially incentivize this. So if they can put you on a ventilator, they get $39,000 for it. If they can give you the remdesivir, they get money. All those two things together, remdesivir, a 30% chance of fatalities, the ventilator, a 90% chance of fatalities. This is a death protocol. This is a euthanasia protocol they're involved in, and they get incentivized financially for it.
Ms. Landis.
And that's pretty much it, except for the face masks. They're also horrible. And the city, again, to emphasize, it's setting itself up for massive lawsuits. This is criminal, what's going on. Thank you very much. I appreciate it.
Thank you very much, Ms. Landis, for your comments. The next person who is requested to speak is Dustin, excuse me, Luchmi. I'm sorry if I pronounced that incorrectly. Dustin, give me 1 second and I will unmute you.
Hello, can you hear me? Hello?
Yes, we can hear you.
Okay, hey. You said my name correctly. I wanted to introduce myself. I'm Dustin Lichme. I am resident of South Philadelphia. I am also co-leader of Project Stand Together Philadelphia. I worked in medical research at Penn and Einstein Hospital for 6 years of my life. If I was not transparent about the risks of the experiments I was doing with my participants, I would be violating the Nuremberg Code. That is currently what's going on with the city of Philadelphia with these mandates. We are not being told the risk of using the vaccine. The vaccine that is authorized right now is currently experimental, as the Comirnaty is not available on the market. We are seeing that many people are having heart and neurological complications, as well as dying from receiving the vaccine. The mandates are based on the basis of stopping the spread. We know now that the vaccine does not stop transmission, even though that CDC Rochelle Walensky has perpetuated that lie, as well as President Biden and Anthony Fauci. We also have learned that Anthony Fauci has told us in an interview with Mark Zuckerberg that the vaccine may actually make you more susceptible to infection of COVID-19. Right now, with the Omicron variant, we see a disparity in the reporting of the severity of this new variant of COVID. We see in South Africa that it is not as bad as the American media is making out to be. It is actually something that we want the population to catch, as the symptoms are very mild and people will likely not be hospitalized and they will gain natural immunity. The mandates ignore the basis of natural immunity. People have already recovered from COVID, and people who have allergies to the vaccine or other predispositions for why the vaccine might be harmful to them. By implementing these mandates, you're excluding people from society on the basis of their medical choice and their right to make their own medical decisions for their bodies, knowing what they know. We also live in a predominantly Black city. Only 11% of the Black community of Philadelphia is fully vaccinated. So these mandates are also racist by excluding the Black community from city activities. The Black community has reasonable distrust in the medical community for experimentation and past crimes against humanity committed against them. By implementing these mandates are a crime against humanity. They are violating the Nuremberg Code. And by doing so, you are acting as a war criminal and would be tried as such, as legal action would be taken. I really hope that you reconsider these mandates. Please do not implement them. There is no basis in science for using these mandates to help curb the spread. We're actually looking into a much more milder version of COVID. We're likely to recover, but it seems like this pandemic will never end, as politicians have other goals for voting and for financial gain to keep it going on. That's all.
Thank you very much for your comments. The next person that we have is Anbap. 1 second and I will unmute you if you are ready to speak.
Hello, I just wanted to reiterate some of the points that Dustin had made just right now, but also explaining the fact that a lot of the Black community and the Black and local small business owners are taking the biggest hit with this coming mandate. A lot of them are not aware that you guys even hold meetings as such as these, where they can voice their concern with what is going on at this moment. They have no place to express that they will be directly affected by mandates such as these. These Black businesses and local businesses, small businesses, are suffering at the hands of this and have been suffering since day one. And whatever small incentive doesn't make up for the fact that they may be losing customers, losing money, losing jobs, and losing their way to make money and fend for themselves. Where last year, as we all know, it was a big point to focus on Black businesses. There was articles all over the place. There was information and news all over the place to pour attention into these businesses out of what happened, where we realized that these communities were disenfranchised and treated unfairly. And yet now it's very much being swept under the rug and being ignored that these people may be suffering at the hands, and you guys aren't directly talking to them and asking them if it is or if it is not affecting them negatively and how they can be supported during this time. So that's number one. Like Dustin said, again, as you know, only 11% are vaccinated, and if most of their customers are not, forcing them to do these, and how you guys exactly will enforce these is also a big question, where it can cause a lot more issues and a lot more problems than it can help. So the restaurants are not the problem. I think people are able to gauge and be able to weigh their own measures and safety themselves if they feel confident, if they have natural immunity or anything like that, where they are comfortable enough to go into a restaurant like they were in the beginning of the pandemic. Because as you know, there were not these rules in place at the beginning, and people still trusted themselves and wanted to support businesses of their own to go to these meetings. So now in this sense, where you guys are stopping this, their ability to be able to do this, you're not asking them how to go forth. And that is my main problem, as well as everyone else reiterated the science and the points very well previously. Thank you.
Thank you very much for your comment. We did receive a message in the chat from Dan Auerbach that I'll just read into the record at his request. It states, "Can you please tell us whether the board can commit to a date by which it will make a decision?" And Dustin Luchme, I see your request to comment once again. I'm going to go to the caller first to make sure the person who joined the meeting by phone, who I don't know if they can comment in the chat, are able to submit their comments. Although now I'm not seeing that person at the moment. Is there anyone else that would like to comment that has joined the meeting? Could you please submit your name in the chat function or raise your hand to do so? And if we don't have anybody, I will briefly give Dustin Luchme the floor again. But Dustin, as you've already spoken, I want to prioritize other members of the public. Okay, Frank Pater has requested a comment. Mr. Pater, I will unmute you now.
Hi, thanks for taking my time, or taking your time to hear my comments. I did submit a written comment as well, but I'll summarize here. I just want to point out that mandating vaccination in restaurants is ineffective, burdensome to an already struggling industry, and most importantly, highly immoral. Therefore, you should definitely not implement any vaccine mandates. It's clear that COVID-19 is endemic at this point. It's not going away. Anybody who's been watching the news the past week or so definitely has seen multiple reports of fully vaccinated plus boosted people coming down with COVID. Many of those have been in indoor settings where everybody in the building was vaccinated and sometimes masking. Plainly put, that means COVID's continuing to spread even when everyone is vaccinated and masked. Therefore, like the only way to prevent restaurants from being a vector by which COVID can spread is to close them again completely. Multiple studies have confirmed that vaccinated people can catch and transmit the virus at the same rate as unvaccinated people. Further, for the past 4 months, I think, bars and restaurants have had to choose between either requiring vaccines or universal masking. I would ask if there's any data suggesting that the restaurants and bars that chose the former have had less COVID transmission than those that chose the latter. The vaccines have been available for almost a year now. Do we really think that anyone who's chosen at this point not to take one is going to change their mind in order to go out to dinner? I don't think so, given the passion with which this topic is debated daily everywhere. The restaurant industry is clearly struggling due to last year's shutdown and ongoing hesitancy by the general public to go out to eat as it is, right? Even when people are vaccinated, they're still nervous. When you walk around the city, you can see help wanted signs everywhere. It's obvious that there's a shortage of workers. Burdening the restaurants with these additional record keeping requirements and limitations on staff and customers are going to continue to force that industry into decline. Tourists will avoid the city. Combined with the fact that this is not going to slow the spread of COVID at all. This is a lose-lose proposition. It's making things much worse for the city. COVID's going to continue to spread. Restaurants will continue to decline. Forcing businesses to discriminate when they don't want to is going to further encourage their owners to shut down or leave. Lastly, it's terribly unethical. You're formally segregating society by codifying discrimination against a group of people into a city regulation. The low vaccination rates have been mentioned among minority and marginalized communities. It's very immoral to bar a class of people from public accommodations based on a personal medical decision regarding a brand new class of medicines, the long-term effects of which are just not known, can't possibly be known. I think everyone knows in their heart of hearts that this kind of segregation is wrong. And on top of that, it just won't work. So I appeal to your sense of humanity and reason and respectfully request that you reverse the decision. That's all.
Thank you very much for your comment. We did have Christina Sloat was the next person who said they would like to speak. Christina, are you ready?
Yes,
Thank you. The floor is yours.
thank you. I'd like to read a letter that I had written to the Philadelphia Inquirer back in August. As one might expect, it was not. And so I'd like to read it to you today. It's still relevant. So letter to the editor or to whom it may concern. Forcing masks on the unvaccinated is unconstitutional, unhealthy, and unlawful. All research papers written prior to this planned technocratic takeover support the shocking idea that our nostrils are meant to inhale a particular ratio of gases and a particular volume of oxygen versus carbon dioxide. When we wear a mask, we are denied the proper volume of gases, and we are forced to inhale the wrong ratio of gases. We are also unable to exhale the viruses, microbes, the viruses and microbes that we are meant to, therefore trapping them in our airways. Forcing the body out of homeostasis in regards to gases and to the exhalation of microbes stresses the body's systems and organs, which means that if you do come in contact with a virus, you'd be more likely to come down with one. All of this is true of all of us, much less someone who already has a respiratory or other medical problem. If anything, the disabled or otherwise medically compromised are the last group of people that should be forced to deny themselves oxygen. Those people are also most likely to suffer most if vaccinated. That is to say, these people, anyone that feels that the masks or vaccines are not appropriate for them should not be asked, coerced, or forced to wear one. And any attempt to intimidate them into wearing a mask or to vaccinate when it would otherwise not be recommended is cruel and inhumane. Are you trying to further stress their weakened bodies? You might as well join the neo-Nazi party. If you research asthma, bronchitis, pneumonia, oxygen, even the conditions under which cognitive functioning is best supported on PubMed, which is available to anyone. And you look for research done prior to the COVID situation, or when such issues became overly politicized by biotech, pharma, big tech, and their allies, you will find that the denial of oxygen impairs organ and cognitive functioning. It is clear that viruses are always in our environment, particularly in our meats, our vegetables, and poorly regulated and understood nanotechnologies are in our pharma, food, beverages, and daily vitamins. If you want to survive COVID-19, demand that the FDA and USDA and other federal agencies take a closer look at nanomaterials, quantum dots, and nano micro electrical mechanical systems. So here I'm switching topics a little bit away from the masks and which is relevant to the indoor and outdoor dining. And now I'm trying to refocus or introduce the subject of what exactly are these symptoms caused by, and to suggest that we need a larger, wider perspective, that we need to consider that there may be other factors affecting our health and inspiring these symptoms. So what we really need to be doing, one of the things that isn't being done and hasn't been acknowledged here in the US, the EU and Switzerland are far more advanced in discussing and tackling the issue of nanotechnologies in foods, for example. In Switzerland, in May of 2021, all nanotechnologies in foods, or any processed food that includes nanotechnology in the food, it must be labeled on the packaging. Okay, so we need to be demanding that federal agencies require more of pharmaceutical companies, mandating that they share their intelligence on nanotechnologies, and demanding that companies that manufacture and disseminate nanotechnologies in any edible or injected product should be required to label a product with the shape. Is it flat, cage, nanotube? What is the shape of the crystal or structure of the nanotechnology? And how has it been functionalized? This is relevant to the issue of vaccines. There was a rumor that some of the vaccines included graphene. Most modern day technologies modern day vaccines do include or involve nanotechnologies. Nanotechnologies are not malicious in and of themselves, not at all. The question is what type of nanotechnologies are in there and why are they in there? Graphene in and of itself is not a bad thing per se. That rumor was not well explicated or unpacked in the media.
Ms. Slaughter, I just want to note that we're coming up on 5 minutes, so I would ask you to summarize your comments. Thank you.
Thank you. I actually had neglected to check the time. How do I have 1 minute left or less?
Yeah, you have about 1 minute, yes.
1 minute? Okay, thank you. So all of these things should be on the packaging. So I'm just gonna put that out there. It's not something that I've heard. It's not something that's really being explored on CNN. But CNN, when has CNN ever been about health, the health of the individual? And each of us as individuals, we create a collective, the public. I would like to mention that this just to refocus on the individual there. All right, so if you'd like to, I'm going to skip some here. If you'd like to, if you really do feel like an airborne virus is the issue, then use the mask yourself, right? But please remember that it's not the best for everyone and that we do have to keep our individual biologies in mind. Likewise, the vaccine. I think that we should return to this idea of democracy where we each get one vote, or that our votes and our voices matter. I believe all of it should be a choice, your choice. When you're dining, you should have the right to be inside if you should choose that that's the place where you like to eat. I don't feel that a public mandate on this issue was ever warranted, but I think particularly now we can see that There's always going to be a new reason, a new virus, a new fear or scare coming from biotech and pharma. So I think we should dump the insanity and reclaim our country, reclaim ourselves, reclaim the planet, reclaim an anti-fascist, anti-totalitarian, pro-human rights, your right to your own body mentality. Thank you.
Thank you very much for your comment. I want to go next to anybody who is called in on the phone. I just saw somebody, but I don't believe they are with us at the moment. Is there anyone else who would like to speak? Dustin, I know that you have submitted a couple written comments, which I am recording for the record. Those will be included in the written comment record. Thank you very much for those. I'm just waiting, giving anybody who else has joined the call time to decide that they would like to speak. I could go around and call names if we think that's appropriate. I will start doing that, I guess, just to make sure that everybody has a chance if they would like to comment. First person I see is Hayat Ali. I'll ask to unmute to see if you want to say anything.
Hi, this is Hayat Ali. I'm from Salam Cafe, and I'm very new for neighborhood. And I just started my journey in Germantown like 6 months ago, and this COVID scared me so much. The business is going slow, and I don't know what's going on, honestly. I need advice, and then I need feedback and from the people, from the neighborhood, and from everybody. Because I'm new for a business and I'm just having like a fear of what's going on. That's all I want to share. Thank you.
Thank you very much. Appreciate your time and comment. Okay, let's see. I see Linda Toscano. Linda, would you like to submit a comment? I'm sorry, Linda, you're still muted.
Okay, is that all right now? Okay, I submitted a few comments before the meeting and I wanted to see what everybody else said so I didn't duplicate. I think I have one thing that I didn't hear anyone else mention, so I'm going to read it from my email. So this is what I said. If you truly want to save lives, you should make a mandate requiring all doctors, hospitals, and pharmacies to allow early treatment of COVID using such things as hydroxychloroquine, ivermectin, vitamin D, IV vitamin C, etc. This is what would make Philadelphia death numbers go down and set an example for the nation. Have you done research other than the mainstream propaganda? How will history judge you? Lots of good people have followed tyrannical governments before. In other words, we aren't even allowed to use medications that will help us if we do get COVID. You can't buy them. You can't get them. You have to get them online from other states. You have to get them, you have to order ivermectin from India. Okay, I had COVID. I'm 68 years old. I got hydroxychloroquine through moving heaven and earth. I got, every symptom was gone in 24 hours. Okay, lots of people have died unnecessarily. This bullshit, excuse my French, about closing restaurants and all this, it's doing nothing. Like, it's stupid. Have a mandate that actually means something. So as far as that, I think my other points were covered by other people. I just wanted to say that.
Thank you very much for your comment.
Mhm.
Okay, I'm looking through the list here to make sure I haven't missed anybody. I see Daniel, Raso Yaras. Daniel, would you like to make a comment?
Sure. Yeah, I wouldn't mind. I actually think that many of my well, I don't know many of them, but I consider them friends at this point because anybody that is that has the courage to stand up against totalitarian orders and mandates. Again, we know that by the first speaker that this is not the law, and we should bear that in mind every time that we go into a restaurant. And I remember also that I continue to work only because I have medical exemption. I have glomerulonephritis, chronic glomerulonephritis that made me undergo surgery. Basically, I have a kidney transplant, and I know, even though Penn, of course, it's in on this, but they decided that basically, even if there could be adverse reactions to the vaccine for patients of that kind, of some sort of because I am immunosuppressed as a result of being, of course, of the transplant. But the idea is that there were adverse reactions, basically kidney disease as a result of vaccination. In rare cases, maybe, but basically you are taking your chance, and then you are not even questioning the risk assessment. It's just take it, no matter what, no matter who you are, no matter what your conditions are, no matter who you are as an individual, because this is all about the greater good. And it's about solidarity, and it's about love, and it's about weaponizing love. That's what it is. It's weaponizing like good-hearted feelings that people have in their souls, and you're turning that against them, and you should be ashamed of yourselves. And I know you're not, because at the end of the day, you think you're right. That righteousness that gives you, the expert notion that they know they're right. And you may know in your heart of hearts that you're not, but you won't acknowledge it. And you will continue with this until I don't know when, but I know all over the world, people are rising up, and you will have to answer questions to them, to me, and to everybody else. That's it.
Thank you for your comments. Okay, I haven't received any more requests for speaking, but let me just double check the chat to make sure.
And while you're doing that, I just want to answer Dan's question in the chat. The board will provide notice before its next meeting when it will consider our report on today's hearing with any changes, if any. We can't provide a date today, but we will. That will be after the new year.
Thank you, Dr. Bedigal. I see we have a couple people still on the line who haven't spoken. So if you would like to speak, you're free to unmute yourself and give comment. I just don't see your name, your full name. So if you would like to speak, please identify yourself by name. Okay, not hearing any further comment.
Ben, I'd like to make one final remark, if I may.
Okay, Dustin.
I just wanted to say that by putting these mandates in that with regards to the Nuremberg Code, you are not allowing people to make an informed decision because you are punishing them for making whatever medical choice that they make. The vaccine should be available to all who want it. For those who cannot take it for medical reasons or who do not want to take it or who have already had COVID-19, there should be no punishment for them making that choice. And by mandating this vaccine to participate in society, you are not only furthering racial inequality, but medical inequality. And you are committing a war crime. As a previous researcher, if I were to punish one of my participants for choosing not to participate in my study, I would also be committing a war crime because they would not be able to give informed consent and feel that they were not being pressured to do something that they don't want to do. If you really cared about public health in Philadelphia, you would make the therapeutics, the ivermectin, the vitamin D, accessible to Philadelphians. They're very cheap. You'd be able to give that to the communities in need. But you're choosing not to do that. And that speaks volumes about your approach to public health, that you don't care about public health. You care about furthering medical apartheid and dividing the city.
Okay, thank you. Thank you for that comment, Justin. And with that, Commissioner Bedegal, I'll turn it back over to you. Thank you, everyone, for your comments.
So I want to thank everyone who's participated in this public hearing. As I mentioned at the beginning, the board will be considering all of the comments that were given here this afternoon, as well as those that were submitted in writing. They will be issuing a report that will include any changes, amendments that they decide to make to the regulation. There will be a discussion of the board, a meeting of the Board of Health to discuss in early January. Joe, is there anything else that we should be adding at this point?
No, Dr. Bedegal, I think that's it, unless there's anything else that the board would like to add at this time. Otherwise, I think it's appropriate to wrap up and adjourn the meeting, excuse me.
Thank you. Any of the members of the board who would like to comment? Well, I want to thank everyone, both our Board of Health members and members of the public who came for your comments, for your engagement in this issue. Very much appreciate you. Everybody, please stay safe and have a good night. I'll now adjourn the meeting. It is 5 p.m.